Welcome to all of you for this very exciting webinar. As Andrew said, the title is Achieving the Sustainable Development Goals, Reaching the Communities Left Furthest Behind. This webinar is hosted by Gavi, the Vaccine Alliance, and the International Vaccine Access Center at the Johns Hopkins Bloomberg School of Public Health. My name is William Moss, and I'm the Executive Director of the International Vaccine Access Center, and it's my great pleasure today to moderate this session with four wonderful speakers. The purpose of this session is really to spotlight the MIS communities across the Sustainable Development Goals thematic areas, the challenges of reaching these MIS communities, and what each organization is doing to reach those left furthest behind. And we've brought together four panelists with very diverse voices and perspectives on this, what may be one of the most pressing, is one of the most pressing challenges facing the global public health community, and that is reaching the most vulnerable, the communities left behind, and the zero-dose children. So we have four panelists today, and I'm going to briefly introduce them, and then we'll get into the talks. Our first panelist is Ms. Bujela Nokunsida. She is an elected member of parliament in Eswatini in Southern Africa and is representing the Inter-Parliamentary Union as a member of that organization's Bureau of Women Parliamentarians. The Inter-Parliamentary Union is the global organization of national parliaments which works for peace, democracy, human rights, gender equality, youth empowerment, climate action, and sustainable development through political dialogue, cooperation, and parliamentary action. What a wonderful and broad range of activities. So welcome, Ms. Bujela.
Thank you. Thank you so much.
Our second speaker is Ms. Kalila Mboy. She is a creative performance director and social entrepreneur from Tanzania, who is the founder, managing director, and chief executive officer of Unleashed Africa Social Ventures, an enterprise that trains gifted young people in the performing arts. And I've also heard her describe herself as a disruptor. She is also country director in Tanzania for Girl Effect, an international nonprofit that creates media content for adolescent girls in Africa and Asia so they can make choices and changes in their lives. And she believes that, quote, African youth can, should, must, and will set the agenda for a better world. All we have to do is believe and work despite all the challenges. So thank you, Halila, for joining us. Our third speaker is Ms. Sonia Angelen Panzani. She is a senior program manager and development specialist who has worked extensively in health system strengthening and child protection. She has extensive experience fostering innovation and harnessing the power of digital solutions, including in scaling up interventions. She is the head of country action for Scaling Up Nutrition. The Scaling Up Nutrition movement was launched in 2010 by the United Nations Secretary General and is a country-driven initiative which brings together thousands of stakeholders, all united in their mission to end all forms of malnutrition by 2030. So welcome, Sonia. And our fourth speaker is Ms. Ana Maria Bahar, who is Director of Public Policy Engagement at Gavi, the Vaccine Alliance. Previously, Ana Maria was Global Director of Advocacy at International Planned Parenthood Federation, and before that, the Associate Director for Asia, Eastern Europe, Latin America, and Caribbean at Frontline AIDS. She has worked in Cuba and at the Ministry of Health in Peru on primary health care, and is a social anthropologist by training with a Master of Science in Health Policy Planning and Financing. So thank you for joining us, Ana Maria, on behalf of Gavi, our co-host. So we'll turn it over to our panelists, and Ms. Bujela, I'm going to turn it over to you for your comments and your perspectives as a parliamentarian.
Greet everyone, and I'm grateful to be part of this Gavi webinar. What happens is that parliamentarians can be effective agents of change Building strong and effective parliaments is necessary for the multi-sectoral approach needed to tackle complex challenges. The COVID-19 pandemic has further highlighted the importance of putting parliaments at the center of efforts to oversee the action of governments and articulate and respond to the needs of the people. The oversight function of parliaments have never been so important. Information collected by the Interparliamentarian Union during the pandemic has shown that parliaments have taken steps to review the COVID-19 response from a gender and human rights perspective, and the assess of the impact of pandemic on children and youth, including the teenage and pregnancy and gender-based violence. An important factor is the participation of women in COVID-19 committees during the response phase, but more broadly in parliaments. According to IPU data, only 26 of parliamentarians worldwide are women. Much more needs to be done to ensure more positive effects on gender equality and women's rights in law and in practice. Parliamentarians also play an important role as representatives of the people. During the pandemic, there have been many outreach initiatives to sensitize communities and understand the immediate needs. As part of the IPU work on universal work coverage, parliamentarians have reported new barriers created by pandemic for vulnerable population in access to health services, including misinformation, disruption of sexual and reproduction health services. It is crucial to understand who is not accessing services and why. Official statistics can help, but parliamentarians can give a human face to these numbers and make sure that the voices of these groups feed into decision-making and processes. It is also clear that reaching missed communities and leaving no one behind can be achieved by one actor, cannot be achieved by one actor alone. Initiatives such as this one are important to build mature understanding among stakeholders and promote closure collaboration at the country and global levels. Well, as a member of the IPU and being in the committee of the SDGs, as a Swazi as well, there is a lot that has been happening. And the impact of the pandemic in Eswatini accessing sexual reproduction health, it has been affecting Swazi, it affected, I think, everybody. And that's what we're saying, that with what happened, the anecdotal data showed a 50% increase in access to family planning by women and a 47 adolescent at the start of the COVID-19 infection in the country. The negative impact, women's ability to achieve their desire, family size, potential resulting in a compromised quality of life. The government prioritized the national response and essential health care services, such as family planning, suffered severe shortages of production health commodities were experienced towards the end of 2021. The rapid assessment showed, for instance, that when senior classes reopened, more than 300 girls could not return to school due to pregnancy. One of the identification that fertilizer rate was increased. So I'll be very brief in this because, you know, there's the question that says now, who are the missed communities, those that are left behind, and why, you know? So the marginalized groups, mainly other adolescents, the youth with disabilities, the LGBTQIs, and the sex workers. And why? And why are they left behind? It's because they're scared. There's stigma, discrimination, harassment, and violence abuse, bullying, lack of protection, and lack of privacy, limited access to sexual and reproductive health, services, and legal services. And the last question is that what is the Parliament of Eswatini doing about it to address such challenges, to reach these communities, and to work across the sectors? Well, as parliamentarians, there's a lot of work that we have to do, that we are doing as well, like to advocate for SRH on behalf of our communities, to create opportunities for inclusive and the active engagement of CSOs presenting the marginalized groups in developing and revision of policies and in constitutional review. And also to ensure that laws fully protect people with disability and pass the disability laws. Facilitate the timely and implementation, monitoring, and reporting of programs and policies. And also to advocate for full engagement of participation of key population in policy development. Advocate for a review of the criminal law and sex workers provision, which is very, very important because they're not classified anyway. And also there's a lot that we can do, but eventually what Eswatini Parliament has done so far is that with the youth, we've formed with the youth organization, working with our stakeholders, like our partners, which is FLAS. We have actually organized, with the youth organized as a SRH champion. We became champions to better understand the needs of the youth. And as SRH champions, we parliamentarians, our core duties include participating in all advocacy initiative of SRH, including defending youth-centered policies in the country. Parliamentarians in the Ministry of Health also portfolio has encouraged partners' collaboration to ensure that no activities are duplicated and that the community that have been left behind are prioritized for interventions. This is as far as I can go for now. I don't know if there's any questions. Thank you so much.
Thank you very much, Bujela, for that excellent summary of the role parliamentarians can and should play in reaching communities left behind, with a real emphasis on sexual and reproductive health and some of the factors leading to those communities left furthest behind. We're next going to turn to Ms. Khalila Mboy, who's going to give us the perspective of non-governmental organizations in reaching those communities left furthest behind. So Khalila, over to you.
Hello, thank you very much, William. Thank you for having me on this panel. First, I'd like to just start by sharing a little bit of what we do, because I think it's very important to my response. So over the years, several interventions have been designed for the child with the intention to connect to services such as sexual and reproductive health, services, education, economic empowerment opportunities, and like. Anchored by the aspirations of the Sustainable Development Goals, the development community and governments, some governments have pushed services that address immediate concerns, such as healthcare centers, schools in Tanzania. We've pushed for free education, increasing the availability of contraceptives and the array of access to capital and skill development programs for women. However, even though we have all this, which we strongly applaud, we still see a minimal take of this among adolescent young women in ways that these services still exist in societies with deep-rooted systemic gender norms and beliefs that keep them from realizing the control they innately have over the decisions over the things that matter to them. And on the other hand, the interventions are often designed without the participation of these groups. and hence are unable to answer unseen barriers that actually would hinder her agency to connect with service, right? We build solutions that work for us and should work for her, but they don't. And that's where Girl Effect comes in. Through our brands in Ethiopia, Kenya, India, Rwanda, South Africa, and for us here in Tanzania, Tujibebe, which literally means in Swahili, let's lift ourselves up together. We build up and or back agency to the adolescent girl and young woman for her to realize that she actually, or they actually have control. We walk them through a journey of transformation that meets them at this point of, is this service really meant for me to listen, I have a dream, my well-being is important, and these services, and these are the services and realities I need to meet those dreams, right? So we are what we would like to say a bridge, generating demand for services that exist, and in most cases, working and being a thought partners to various organizations working on service delivery to ensure that they contextualize the needs and the nuanced realities of those they're hoping to serve as they're designing for programs. I'd like to say that the effect of the pandemic, as I'm talking about the girl child, the effect of the pandemic has not been gender neutral, and that's what we've seen. Vastly differences, different impacts on women as compared to boys and men. Of course, we can talk about the biological and psychophysiological factors, but then the larger issue is the social and economic roles that they both play. What we have seen this have been aggravated with gender norms and beliefs existing in the context of the societies in which they live. And these intensify the vulnerabilities of girls in ways we have not seen in years. From the third school drop, many of these girls never returning, to girls having to pick up the bulk of caregiving responsibilities and hence shifting their priorities from education to rearing the household. An unprecedented rise in teenage pregnancies, this recent spotlight on gender-based violence like never before. We've also seen that this lack of access to education, healthcare, and sexual reproductive health services, such as HPV vaccines, have left girls and young women at high risk of dependencies that largely exacerbate the vulnerabilities in the same communities, right? And this is what I'd like to call, the COVID-19 has brought what we call our gender regress, right? We have rolled back hard-won gains that have been made towards gender equality over the years. And so then the groups that we have missed in terms of missed communities, so I've talked about adolescent girls and young women, but then there are also children. As stats tell us, 12 million women and girls in low and middle income countries have lost access to contraceptives, leading to over 1.4 million unintended pregnancies. There being teenage pregnancies. 20 million secondary school girls have been forced to leave the classrooms because of this crisis and will never return. And without education, we know how, given the role that women play in bringing up society, educate a girl, educate her community, right? Her whole society, that exasperates the possibility of her community, her family going into extreme poverty. Vaccine uptake, 25 years of vaccine progress has been lost in the first 15 weeks of the pandemic. When it comes to HPV, we have over a quarter of the coverage of HPV vaccines that was achieved in 2019 has been lost globally. This has grave consequences on the health of women and girls, as the global coverage of the first dose of HPV vaccine is only 15% now, despite the first vaccine being licensed over 15 years ago. When it comes to routine immunization, so children, immunization rates have reached all-time lows here in Tanzania. We have had an intensifying pressure to reach now the increased zero-dose communities. Because why? Our focus, of course, changed to making sure that we're protecting communities against the COVID-19 pandemic. However, these have largely been behind because they did not necessarily create as a whole. So what are the challenges that we're now seeing in facing them? Of course, the massive challenge we see is the vaccine is the barriers around gender norms, the perceptions of the families. We see that many right now, in terms of the work that we're doing, we're seeing there's a resist to now come back and uptake service because of just the norms and the myths that have come around circulating the vaccines. And we see internal barriers that have been exacerbated by the pandemic, looking at her own concept, like of her innate belief in who she is. So what Girl Effect is doing at the moment, we're looking to address these things that I've talked about right now, from education to access to sexual reproductive health information and services to HPV vaccine uptake. We are now embarking on various campaigns and various programs. For example, one with Gavi that is looking at building with the community, making sure that we are building a campaign that confirms or allows us to measure the norms, going in communities that are hard to reach, working with communities, taking their context and their newness in play, working with them to create solutions or to create what we call this campaign that we're about to do with Gavi, so that we ensure that their thoughts are taken into account as we're designing the programs. Girls who live in most of these communities that have service, we find that they're not uptaking, right? Now, the thing that we're doing as Girl Effect is trying to learn, working with them to create solutions, or working with them to answer the why, so that we make sure that we are increasing uptake. But at the same time, how are we doing this? For us, it's really about using the power of media and technology to drive demand, right? To drive demand, but not create the purpose for ourselves, but make that the voice of the girl child is first and front and center as we design our interventions. Our Gavi partnership is going to last for 4 years. We've had another partnership just ended over the past 4 years, where we had campaigns in Tanzania, Ethiopia, Malawi, and Rwanda. And what we wanted to do was address some of the barriers that girls face to getting the vaccine, the HPV vaccine. We were working knowledge around cervical cancer more general. What brought about was an increase 43% more girls knowing of the HPV vaccine after listening to us, and 42% more girls now knowing about the HPV vaccine, moving into taking up that the second dose of HPV after listening to our radio show. And I say that because we did find out that even though many people were uptaking the first dose of HPV, we were not following up with that for that second dose. So working with communities, working with service partners on ground, making sure that we're building those linkages and making sure that we're putting the girl child and the young women in the center of our design process.
Halila, thank you very much for giving voice and articulating the perspectives of people and communities, particularly adolescent girls and young women, with regard to their education and their demand for services around sexual and reproductive health, around HPV vaccines, and how community-based non-governmental organizations can kind of help overcome some of the systemic barriers, many of which have been exacerbated by the COVID pandemic, as you highlighted. So thank you very much for your energy. I'm going to turn next to Sonia, Angelen, Panzani, who will give us the perspective of the Scaling Up Nutrition movement. As I said, it was launched in 2010. So Sonia, over to you.
Thank you so much. So first, a few introductory words also, so that you can also understand a bit further, unpack what the SUN movement is. So indeed, it was created back in 2010 to respond to actually a food and nutrition crisis, and yet again, we were facing another one, with the realization that we needed to take a multi-stakeholder and multi-sectoral approach to respond to all multiple forms of malnutrition, because all one entity could not do that, obviously. So it's really like bringing the donors, the business, civil society, the UN agencies, as well as media, parliamentarian, youth, with the government, and support to the government with our SUN focal points, to actually align around country priorities for nutrition and position nutrition at the highest possible level of the political agenda. So what we do is basically we guide, we support, we nudge, and we connect 65 countries and 4 Indian states in their institutionalization processes for nutrition through high-level advocacy, enhanced coordination, capacity strengthening, technical assistance, and knowledge management. With that being said, what has been the impact of pandemic in our sector? Well, of course, like other sectors, we've seen massive disruptions when it comes to accessing essential health and nutrition services, leading to severe food insecurity, leading to a number of people unable to afford healthy diet that has reached, unfortunately, the dreadful figure of 3.1 billion, according to the Sophia report this year. We've seen also at a more operational level, reported by our son countries, that there was less trust for people to access the primary healthcare facilities. So we've been supporting the countries in making sure that guidance, including in local languages, was available when it comes to the continuity of services. And also, the countries really realized during this period that they could not rely only on those household surveys because of the restrictive measures imposed by the COVID-19 management crisis. And through that, they realized that they needed like real routine information systems, strong, robust, real-time, with early warning component to it, to face any kind of crisis and respond when it's needed, where it's needed, including to the furthest left behind. So we've seen countries getting very creative, and this was really inspiring, like countries that didn't have back then an information system for nutrition, nor individual information for nutrition cases like Comoros. And they really got creative and developed those information systems. And I think that what we've seen is also, of course, the acceleration of the use of digital tools, and obviously this is a positive element that we could see from this crisis. And also we've seen, of course, that unfortunately access to nutritious food was made more difficult because of lockdown again and restrictive measures. So this led also the countries to realize their strong, for the most part, dependency on food importation from other neighbors countries. And this also contributed for them to get better prepared for the next crisis, which is the current one in terms of the scaling and nutrition movement that we're facing is also this huge food crisis and nutrition crisis. Also, what we've seen is the desire from countries to learn from one another. This has also really accelerated peer-to-peer exchanges, because there is nothing as powerful as for a country listening to a great experience in a challenge that another one is facing in a related context, so that they could replicate this. So we're seeing increasingly this request from countries, and we've seen also that all in all, they really wanted to strengthen like the roots and pillars of their systems while addressing those crises, meaning like investing more on, again, information system, human resources, financing for nutrition, as well as the logistics. So who are the missed communities, those left further behind? I think I would definitely agree with all the other speakers on that. Children, women in the urban, peri-urban settings, as well as remote rural areas. And of course, I'm not forgetting about the ones living in conflicted areas. So challenges are also about knowing who they are and like, again, getting back to this issue that is quite pressing, I think, about the lack of nominative individual data to target intervention where they are needed and when they are needed. So what to do about that? I think that packaging services that make sense from the different sectors to leave no one behind is highly recommended. And that's why I'm really grateful for the partnership that we have with Gavi, in the sense that we can piggyback on the great coverage that vaccination services have in order to bring also nutrition services. And I think we need to do more of that because in a very limited financing environment for those interventions, we actually need to come up with those kind of one-stop approach, being in the primary healthcare facilities or at the level of the communities through advanced strategy to reach the further left behind. And I think the one key thing is also the protocol digitalization that can help. Because I think when we've built this partnership with Gavi, we thought that, okay, also the ICCM protocols and the IMCI, which are the protocols to actually come up with the right diagnosis for under sick 5 children at the community level and at the clinical level, would help also in making sure that we are providing a holistic approach and integrated services. So we have been, as the Scaling Up Nutrition Movement, documenting good practices in that sense and making sure that we disseminate those to inspire more countries. And some countries have now also decided to make bold nutrition commitments when it comes from the Nutrition for Growth Summit in Tokyo last December, also in the field of information system. I think we need also to encourage academia to do even more because we need the evidence from the research in terms of what are those packages that make sense, that make a difference, and actually enable us to reach impact. And I think that this calls also for more digging deeper into every sector and every stakeholder's contribution. Of course, we have established those platforms, multi-sectoral and multi-stakeholder one, but we need to go a bit further, like who could participate that is not participating yet. And we need to have this iterative approach where we keep on learning and keep on adjusting and doing better. Then I think we need to also make sure that those platforms are really going to the subnational level. So we have more than 81% data from our countries that actually have a platform that is going at the subnational level. But still, we need to do more on this front because this is the only way where we are making sure to also reach those furthest left behind. And also because it's the only way to really make sure that we are scaling up approaches and interventions. Also, what we've seen is countries being truly inspirational in the sense that we've seen them facing multi crises at the same time. The pandemic crisis, the food and nutrition crisis, while at the same time, huge security crisis. For instance, if I'm referring to Mali in this very, very difficult context that they are facing, they have managed to hold on to the infrastructure for nutrition and develop this amazing multi-sectoral action plan for nutrition and going a bit further also in terms of decentralization. So this is truly inspiring. Then I think that yeah, it should bring us also to think further about how we are investing again for those solid grounds so that the countries are prepared to face any type of crisis upcoming. Again, investing on information system, HR, those coordination mechanism, and with the of course the spirit of leaving egos and logos behind, because it's about joint efforts to actually reach objectives. Thank you.
Thank you very much, Sonia, for highlighting the role of the Sun movement in raising the profile of nutrition in countries, particularly in light of the COVID disruptions and the other crises and challenges that many countries face. I'm particularly impressed with the support that the Sun movement provides for countries to create their own, generate their own creative solutions, as you highlighted, and share those solutions with other countries for lessons learned, particularly in the areas of integration of services and the use of novel information systems. So thank you very much. Our last panelist is Anna Maria Bahar from Gavi, the Vaccine Alliance, our co-host. So Anna Maria, I turn it over to you.
Thank you very much, Bill, and good morning, good afternoon, and good evening, everybody who attended to this webinar. It's really an honor to speak after Nukul Seda, Sonia, and Khalila. And yes, so I think I will start by sharing with you some data which is quite concerning about the Sustainable Development Goals and their fulfillment. And I will ask someone to help me in putting a presentation available for you. Yes, right. So the first message that I think should actually affect our sleep, I would say, is that the Sustainable Development Goals are tremendously off track. As Sonia was mentioning, the number of crises that now are affecting people's lives, from violent conflicts, food insecurity, and the climate crisis have reversed decades of progress. But those issues happened before the pandemic as well. So I think that's something very important to recognize. And of course, hit the most vulnerable and most marginalized communities. If you can see in the first slide, an additional 95 million people have been pushed into extreme poverty since the beginning of the pandemic. 150 million more people were facing hunger in 2022 compared with 2019. That's about 1 in 10 people worldwide suffering from hunger now. As of May of 2022, 102.6 million people were forcibly displaced worldwide. 1 in 4 people, or 1 billion people, live in urban slums or informal settlements in 2020. And 2 years into the pandemic, disruptions to health systems are being reported in over 90% of countries and territories. So that is a very grim picture. And we all, I think, have a responsibility to really tackle these issues. If you are a student, if you're an intern, if you're a minister, if you are a development working on the ground, if you are an academic, we from Gavi, everybody has a role to play. And especially, I would like now to focus on some specific population. That is the objective of Gavi's work, which are the zero-dose children. And why do we need to see the backsliding in immunization as part of a bigger picture, but also from a people-centered approach that focuses on poverty eradication, integration of services, and bring different sectors together. So prior to the pandemic, we were seeing positive progress in global vaccine coverage, and the number of children not able to receive even the most basic vaccines had reduced by 14% between 2015 and 2019. If you can please show the second slide. The latest data from WHO and UNICEF, who are also part of the Gavi Alliance, is that global vaccination coverage continued to decline from 86% in 2019 to 81% in 2021. And the number of zero-dose children, who are children with no vaccination whatsoever in their lives, even the most basic one, increased from 13.3 million to 18.2 million of them in the same period. And, there are so much investment of even, new trips to the moon, to the space, and how is possible that in 2022, 18.2 million children do not receive any vaccine whatsoever. It's just, something that should be really worrying us to the core. And that's something that should really prompt us to take immediate action together. So these declines, of course, are parts driven by the COVID-19 disruption, but there's also a number of reasons related to conflicts and health workers disruption, etc. If we go to the third slide, who are these zero-dose children? And here is a moment to really think about people in their communities. So these zero-dose children belong to very deprived communities. Probably their moms didn't get any antenatal care or any access to contraception. Probably, and I have some figures to share with you. They live in places which are subjected to not having water and sanitation and living in conflict and fragile states. But something very important is that many of them belong to highly stigmatized and discriminated communities. And that is something also that is very important to take into account. So they face multiple deprivations and inequity, and also gender-related barriers exacerbated by poverty. And many of them have also lack of official identity, and that systematically exclude them from services, but from their rights. So we see that pre-pandemic analysis suggests that nearly 50% of vaccine-preventable deaths occur in zero-dose children. 2/3 of them live in households that are below the poverty line, so survive on less than $1.90 per day. It's twice as likely that the mother of a zero-dose children would miss out on antenatal care or skilled birth attendance. And 58% of zero-dose children in Gavi countries live in 21 fragile or conflict-affected countries. Slide 4, please. There are also 25 million children under-vaccinated. That means that they may have received one of the vaccines that are necessary to prevent diseases in their first year of life, but they haven't received the full course. So this was 2 million more in 2020 and 6 million more than in 2019 in the latest data, as you can see. So there are a number, and you can just, I think, put away the presentation. What are the policy implications of this routine immunization that needs to be leveraged and strengthened on zero-dose children? There are many international commitments. I think because of time, I won't go through all of them, but I would just mention all of them. That's really the only way that they are really fulfilled is that there's truly translated action at the national level and the local levels. Through zero-dose children, we also can measure concretely who are left behind on the SDGs, and they can be one of the populations prioritized for all of us from the different social sectors to come together to meet needs. International commitments, of course, are the international commitments of universal health coverage, which has primary health care as a cornerstone, and immunization as a really, really important health intervention that brings the community together to care in every country. We have an SDG 3 targets on that. We have the Immunization Agenda 2030, the Addis Declaration of Immunization, the Decade of Action of the UN, and many others. No, but I think it is very important for the accountability that we owe to the communities we serve, but also for the survival, I would say, of the multilateral system, that we really re-energize ourselves and really try to achieve these universally committed targets. What are we doing as Gavi to work on zero-dose children? Of course, we believe that no child should miss life-saving vaccines. Since 2000, our alliance has helped vaccinate more than 981 million children. And the estimation is that has prevented more than 16.2 million future deaths. So our really core now is to work in collaboration with governments, civil society, academia, the private sector, to really leverage and strengthen routine immunization with equity as a guiding principle, and in the 58 low and middle income countries we work with, and including those in humanitarian settings. And that our goal is to reduce zero-dose children by 25% in 2025 and 50% by 2030. We keep those targets as our North Star. We need to leverage intersectionality of routine immunization. As I said before, is not only bringing vaccination to children, but the full range of services to the communities through primary health care, through education, through nutrition. We know that immunization is one excellent entry point, but we don't just are advocating for our piece of the welfare of human beings. We want to work with others. We know that in Gavi supported countries, for every $1 that we spend on immunization, $21 are safety healthcare costs, for instance. So we believe that receiving immunization is also an enabler to breaking the cycle of undernutrition and poverty. We also have a gender policy that we have started since 2021, and we have established gender responsive funding systems within the Gavi portfolio to reach those children. And we work on human resources of health, building cold chain capacity, and supporting community engagement to the full, and promoting also the use of disaggregated data systems and disease surveillance in every country we work with. I just want to perhaps finish because I know that the time is running. That transformative approaches also includes gender responsive approaches as a priority. And I just want to honor the statement of my predecessors in this panel. Women are often the primary caregiver of the household, and also 70% of women are comprise the health workforce. Yes, I think too, I don't know if you have another question for me, Bill, but our main message here is to work together as multi-sectoral partnerships to achieve the Sustainable Development Goals and really be accountable to the communities that are most left behind.
Great, thank you very much, Anna Maria, and I'm sure we'll come back to you with some questions. I want to thank you for your sobering assessment of progress toward meeting the Sustainable Development Goals and the evidence and data that you shared on extreme poverty, on hunger and undernutrition, on under-vaccination and the zero-dose child, and particularly highlight your call to action. And as you very cleverly said, you know, the world is exploring space travel at rates we haven't seen before, but we have more than 20 million unvaccinated children here on Earth. And then thank you for outlining some of the solutions. And I think, you know, one of the theme across all of the speakers was the critical role that women play in achieving all of these goals. So I want to thank all of our speakers for joining us today and sharing their experiences and insights into this very complex, challenging problem, but one that we need to face head on in reaching vulnerable children and zero-dose communities. The goal of this webinar was to really build on the momentum of the recently concluded United Nations General Assembly session and the 2022 High-Level Political Forum theme of building back better from COVID while advancing the full implementation of the 2030 Agenda for Sustainable Development. I just want to kind of briefly summarize again some of the highlights of what we heard today, and then we're going to move into a question and answer session. I invite our viewers to enter your questions in the chat, and we'll try to get to as many as we can. But we started off by hearing the central role that parliamentarians can play in identifying and reaching those communities that have been left behind and hardest to reach. And there's no doubt across multiple domains. Bujila highlighted, you know, sexual and reproductive health, but obviously also related to nutrition and under vaccination or unvaccination. And this is one of the themes that come across, that these are multi-sectorial problems that need to be addressed in an integrated way. We heard from Kalila on the role that NGOs can play in providing voice to the communities, to those populations whose voice may not be heard, and particularly adolescent girls and young women, again, acknowledging the critical role that they play in addressing all of these problems. We heard from Sonia on the scaling up nutrition movement that has really brought together multiple partners at the national and sub-national level to address this really important problem of the global food security crisis, exacerbated by the COVID-19 pandemic, but also other crises, as she highlighted, including conflict in many areas. And lastly, our co-host Gavi, represented by Anna Maria, as I said, has offered a sobering assessment on where we stand here in 2023 in meeting the Sustainable Development Goals, and she's begun to articulate some of these solutions. And so maybe I'll open up I'll turn back to you, Anna Maria, just to open up the Q&A, and then we'll go to some of the viewers' comments. But are there some specific recommendations that you can make to the different stakeholders, some represented here, the NGOs, the parliamentarians, to promote integration and collaboration? You kind of ended on that note to really integrate and work across partners.
Thank you, Bill. And, we are really privileged to have really are working with the organizations represented in this panel with the Interparliamentary Parliamentarian Union. We are developing a work plan of action. And with SUN, we have a joint actually briefing from last year in which we found together some recommendations. So one was to really value and act on a multi-sectoral partnership and whole of society approach, bringing, co-delivering basic services. Co-delivering, I think, is one thing that we need to think about. That if you reach a child with vaccination and he's undernourished, vaccine is not going to work. So it's not just a moral obligation, but it's also, if you like, a technical obligation to provide as much services as possible to those left behind communities. Engagement with CSOs and communities is absolutely critical because of the localized knowledge, but also the very refined knowledge of cultural matters and the nature of the populations we serve. And I think part of my fellow panelists also mentioned on that. Our experience of working on HPV, for instance, has shown that we need to work with non-immunization partners, the education sector and the girls' movements. In the briefing with SUN, we really recommended to governments to ensure that there is immunization and nutrition interventions fully integrated in the basic package of health services in primary health care, to focus on community-based intervention through community health workers who are remunerated with dignity and that are able to reach zero dose. We also call to the international community, and I think this can speak to some of the questions on the chat on kind of also, targeted funding for specific interventions, but also collaboration about funders at the country level, in a much better way. Alignment with global stakeholders, regional and country level stakeholders, and mobilization and the very important role that health workers need to play in these actions was also one of the recommendations from us. Bringing the private sector to contribute to smart value chain solutions for the delivery of immunization and nutrition services, and also the academia, to help us in thinking more holistically and help us in doing functional, actionable, operational research with formative research for programs that are much more comprehensive.
Great, thank you. I'm gonna turn it over to my colleague Victoria Chu to
moderate the chat. We have some really great questions and we're going to try to go through them. I know we've got about 5 minutes, and if people have time to stay on for a few additional minutes, we'll try to get through a couple. And so for Ms. Halila, there are two questions I just kind of wanted to in tandem tackle. One was sort of a question about HPV and the question about whether or not HPV in Tanzania supported, and sort of the cost related to that, because costs obviously are a barrier for many. But the other question was a little more holistic about the political commitment at the highest political level, and sort of how an NGO like yours can maybe work to move that needle. So over to you.
Great, thank you. So I've responded to, just looking at time, responded to the first question, but the second question about the political commitment. So our Ministry of Health, we have signed a 5-year MOU with the Ministry of Health, making sure that we are integral to the entire process of identifying the challenges around people getting vaccinations, as well as giving recommendations and being on the front line at implementing various recommendations. The Ministry of Health has an IV working group. So we call this the Immunization and Vaccination Working Group that has different government departments as well as development partners making the core team. And we sit together every month. We look at the vaccination stats every month. We now identify, assess issues, and not only give recommendations, but we're at the forefront of actually making sure that, you know, there are budgets put to addressing the issues, as well as ability and how the budgets are actually used on ground. So there's a lot of political will and front and center in that conversation, because without government, really, how do you reach the remote and hardest to reach spaces?
Ms. Angelen, did you want to add anything, sort of being on the receiving end or sort of at that decision-making or policy-making level? You know, the next question, one of the questions has to do with the data systems, and I'll read the question and sort of open to anyone's thoughts about the data systems in the countries regularly measure coverage. There's no system in place to measure the missed communities. And surveys are costly and unable to do well. Is there, you know, are there any thoughts about how do we best monitor, measure the missed ones? As you all know, accountability and progress can only be measured if we are able to track that. So any thoughts as to what would be the best approach, or what data are needed, or how could we gather some of that key information?
I may.
Please.
Yes. Thank you for this question. It's an excellent one. I think it's key to what we need to do. I was trying to highlight this during my intervention, actually, because yes, we've been investing a lot in household surveys. Those are very costly. Most of the time, they are done 1 year pre-harvest, the other one post-harvest. It's very difficult to have like a coherent approach. And I think that this demands really investment in routine information system with individual data. And if we want to do that right, a very interesting approach is really like this protocol digitalization. That's why I was referring earlier to the ICCM, integrated community case management, and the IMCI, integrated management of child illnesses, from WHO UNICEF protocol, because in there, it's actually the proper way, like the, to do the diagnosis, starting with vaccination status, asking for the nutrition status as well, going through every possible sign of the IMCI, and then coming to a diagnosis, having actually ask all those information. So if we have that at an individual level, it means that we have an individual information system that is way more reliable and robust. And then we can do a proper case management. And then we know, where to target more our intervention, the zones that we have the most left behind, and actually also the zones where we need to do more follow-up for those cases, because they are not coming back to do the proper case management that is needed. Thanks.
Now, my one question, one of the questions that's come in, and I believe I saw two related, which are, one of the things that we've mentioned hand in hand to make some of the decisions is regularly updated, robust data sources. The other question is one of the challenges of, in the absence of data, or sort of in the face of flying in the face of data, we've talked a little bit, somebody had asked about distrust. Are zero-dose children and mothers susceptible to suspicions about vaccine safety, as we've seen in communities in high-income countries? And so just the last sort of thoughts about I think that's something that's been highlighted or really heightened during the pandemic is this public mistrust. And so, we're not talking about mistrust among organizations to work together, but really at the personal level, the individual level. And so any thoughts about ways that, as we build these collaborations, as organizations are coming together, how can we continue to create demand and sort of reduce the anxiety and distrust that is out there in the public sector among members of the community?
Can I answer that one? Can I answer that one?
Please, yes, you're
Thank
welcome.
you. Thank you. Well, as far as we see things going, I think what we really need, we need to work in partnership and try and be able to get all the data going on, like partner with all the the civil society organizations, United Nations Resident Coordination Officer and the SADC Parliamentarian Forum and the UNFPA. They're supposed to come together like they are doing already to get all the data and be able to work together so that we can be able to get the numbers. We can be able to get the data in place. Because at the same time, the organization, they're making a lot of duplications, of which we don't need to go through duplications. We have to know who's doing what at what level. And we are happy to have people like Gavi doing all this supporting. So it shows that there is more we can do. Because when you look at what happened through COVID-19 vaccines, I mean, they were able to go all over. And you are amazed, very much amazed of what, because they were able to just get away.
Great, thank you, Bujala. We're at the end of the hour. I wish to thank.
Thank you so much.
Can I say something else, Bill? Sorry,
yes,
1
please.
second, just to second Nokunseda's words, but also to invite people to join the Gavi Civil Society constituency that we have. You will find it online. Civil society and communities are absolutely essential to work on vaccine hesitancy and trust. Thank you.
Great. Thank you very much, Anna Maria. And that's such an important organization. So I want to thank our distinguished panelists for very stimulating insights and discussion. We heard from a diverse range of voices and perspectives that I think was very rich in beginning to think about and addressing this very important problem. I also want to thank all of our viewers and just note that the recording of this webinar will be made available and sent to all of our viewers, so you'll have an opportunity to share it and to view it again if you'd like. So thank you to our panelists, thank you to our viewers, thank you to Victoria and Andrew for hosting this and as a co-hosted Gavi, the Vaccine Alliance, and the International Vaccine Access Center. Thank you to all of you.